Hi. Recently, I have come across with an article by WHO that says the expected death toll due to antimicrobial resistance will be somewhat 5.2 million by the end of 2030. Now imagine somebody is dying not because of a particular disease, but the specific medication for that particular disease is not effectively acting on that patient. That's what antibiotic resistance is. Now let's see how we as a dentist is negatively contributing to this growing concern of antibiotic resistance. Imagine you are having a patient with pulpitis. You made the diagnosis and you made the treatment plan to carry out with a pulpectomy or root canal. Now some of you will take 3 visits to finish a pulpectomy. Some of you will do it in 2 visits, or depends on the case, we can even finish it in 1 visit. Now let's assume we are doing a 3 visit pulpectomy. How many of you will give antibiotic on all the 3 visits? Maybe very few of you. How many of you will give antibiotic on 2 visits? Half of you. And how many of you will give antibiotic in the very first visit for sure? Maybe most of you, isn't it? Now the question is it always necessary to give antibiotic for pulpitis? Let's look into this article that gives us the indication for antibiotic prescription before a pulpitis. Let's start from the last. Number 6, a patient who's having an organ transplant. How often we encounter patients who had a liver transplant or heart transplant in our dental practice? Very rare. Number 5, an immunocompromised patient, like patient who's having HIV, or the patient who's under any steroid therapy or radiotherapy, or patient who's having any autoimmune disease. Again, how often we encounter such patients in our dental practice? Still rare. Number 4, in patient who's having systemic condition like rheumatic heart diseases where antibiotic prophylaxis is a mandatory. Such patients are not rare, but not so common. Number 3, patient who is having trismus, that is lockjaw due to an extraoral swelling bilaterally. Most of the time we can simply call it as a case of Ludwig's angina, which is also again not so uncommon but not so common. Now the last 2 points. Number 2, patient who is having systemic symptoms of an infection such as generalized weakness, malaise, dizziness, lymphadenopathy, and number 1, fever. Now let's see what does the same article says about the contraindications of antibiotic prescription in a pulpitis case. Pain, edema, redness or heat, abscess, or a draining sinus tract. So from now on, before you prescribe an antibiotic for a tooth pain or pulpitis, first rule out all the major signs and ask yourself whether this patient really needs an antibiotic therapy. Now personally, from my experiences in pediatric population, when a child comes with a dental pain, I ask the parent whether the child had a fever in the recent past, and they say yes around 90% of the time. And I also cross check whether the child had any common cold or cough, just to ascertain that this particular fever is not associated with any respiratory illness, because children used to get any sort of respiratory illness in that age very commonly. So when I ask whether the child had any such associated symptoms, the parents say no, and they say only fever was there since 1 week or more than that. So when in such cases, you must prescribe an antibiotic. But a child comes to your dental chair and the sole complaint is teeth pain, just don't give antibiotics. Instead, you either start off with a pulpectomy, or if the parent is not willing to take up the treatment in the initial visit itself, send them back with the analgesics and give them an appointment. So we, as a practicing dentist or a licensed doctor who can prescribe antibiotics, we should always be judicious and use it only when it is necessary.